Welcome. Welcome, my dear friends. Myself, Professor Dr. Rajendra Deshpande, would like to welcome you all in my Ayurveda Academy YouTube channel. Today's video is a continuation of our Panchakarma lectures, and today I am going to discuss with you about the Virechana. You know, these are the 5 purificatory processes recommended by Ayurveda in the management of patient treatment. For example, there are basically 2 types of the treatments, Shodhana and Shamana. When the dosha bioenergies, Vata, Pitta, Kapha, are too much vitiated, dosha prakupita, too much, then it is better to cleanse the body by doing the 5 purificatory processes, either or, not all at a time. So either you can give the Vamana when there is a Kapha Prakupita is a predominance. You can give the Virechana for the Pitta problems or the blood impurity problems. That is a Virechana that we are discussing. And then there is a Basti treatment, medicated erythema for controlling the Vata bioenergy. Then there is a Rakta Mokshan, bloodletting for the diseases occurring throughout the body and because of the blood impurity or the Pitta Dushti. Then there is a Nasya, which is recommended for the upward part of your body. So Vamana, Virechana, Basti, Rakta Mokshan, and Nasya, these are the 5 cleansing processes or detox process recommended by Ayurveda. Today we are going to discuss about the Virechana. I have already uploaded the different videos regarding the Panchakarma. You can check in the playlist. For example, what about the Snehana, then Svedana, then Vamana. These all the videos are already there. I have also demonstrated some of the what you can say the Panchakarma allied therapies, for example, oil massages to the leg and to the chest, and what is the synchron massage, etc., etc. So let us start to discuss about the Virechana. Now, in this particular session, we are going to discuss about the pharmacokinetics and pharmacodynamics of Virechana medicines. Whatever we are prescribing to the or giving to the patients, for example, Ashvakanchuki rasa, Ichha Vedi rasa, Naracha rasa, Abhayadi Modaka, how these particular drugs act in our body, that is called as a pharmacological actions of these medicines, pharmacokinetic and pharmacodynamics. In the question paper in a Sanskrit language, the students will be asked Virechana Dravya Karmukatva. This is the Sanskrit word. Karmukatva is nothing but the explain the pharmacokinetics and pharmacodynamic of the Virechana Dravyas. Then in this session, we are also discussing about the different types of Virechanas, then the drug formulations, the different names of the medicines which we prescribe for the therapeutic purgation, cleansing of the body. Virechana in a clinical practice where predominantly we use this Virechana treatment. And then there is one case study that I am going to discuss about the Virechana. Okay. So these are the properties of the Virechana Dravyas. Number 1, Ushna, Tikshna, Sukshma. Then you can see the Vyavai, Vikasi. These are the 5 important properties of Virechana Dravya. Let us start to discuss what these properties do in our body. For example, these Virechana Dravyas are Ushna Virya, or the hot in the potency. Because of these qualities, what happens? Impure doshas, especially Pitta dosha, deeply embedded in the peripheral tissues. You know, Ayurveda has described our body physiology or the pathology with the terminology dosha dhatu mala moolam hi shriram. Dosha, bioenergies, dhatu, these are the tissues, and the mala, that are the waste products. These are the basic elements of the human body. Okay, so these prakupita doshas are stagnated or get fixation in the tissues of our body. So these Ushna Guna, they liquefy these stagnated or what I can say, the attached Dushita dosha in the tissues. Then Tikshna. What is Tikshna? Tikshna is nothing but a very sharp in action, sharp in potency. Because of these qualities of the Virechana Dravyas, the impure doshas stick to the minute cavities, are scratched, taken away from the linings of the tissues. Then there is the Sukshma Guna, that is minuteness. Because of these qualities of the Virechana Dravya, the purgative substances can enter into the minute cavities in the body and able to perform its function. What in short, we can talk about the cell membrane physiology. You know, there are the cell membrane having minute pores, and these pores can transport in and out substances. So these Virechana Dravyas, their principles, active principles, can enter through to the cell membrane. So this is transport across the cell membrane is possible because of the Sukshma properties of Virechan Dravya. What is Vyavahi? Because of the special type of this word, the purgatory substances need not to be digested by the body. That means our usual, what you can say, the food or the medicines, they go first into the stomach, then small intestine, then digestion, absorption, going to the liver, and then to the whole body. But this Vyavahi, and because of the Vikasi qualities, the action of these Virechan Dravyas is very, very quick, because they need not to be digested by going through this liver or the portal route for the circulation in the blood. Okay, it is absorbed directly and can perform its function. Hence, the duration for starting the action is very, very quick. The action is very quick because of this Vyavahi property. Then Vikasi. What is Vikasi? This is also a special type of the quality in the Vamana as well as the Virechana Dravyas. Because of this Vikas means spreading all over the body in very short time duration. Like, for example, you might be hearing about when there is a myocardial infarction and heart attack is there, the sorbitrate tablet is given sublingually, or even the glyceryl trinitrate, these tablets are given. When the blood pressure is high, the dapine capsule is broken and put it into the below the tongue. So this particular sublingual absorption directly is similar to that Vyavahi and Vikasi type of the properties. The purgatory substances have the dominance of Prithvi and Ap Mahabhutas because their action is on the downward direction. There are 5 basic elements: Prithvi, Ap, Tej, Vayu, and Akash. Vayu and Akash in the upward direction, Prithvi and Jala is on the downward direction. Vaman and Virechan, this is the basic difference. Vaman is cleansing from the upward direction, Virechana is cleansing from the, downward direction. Okay. Now, the types of Virechan Dravyas. This is Anuloman, then Strausana. This will be asked in the Viva VOC to the students. What are the different types of Virechana? Anulomana, Strausana, Bhedana, and Rechana. These words you must remember, the types of the Virechana. What is Anuloma? This is ascending order. The action is mild, moderate, and very strong action. So this is a Bhedan Rechan is very strong, but Anuloman and Stronson are milder, very soft and gentle type of the cleansing of the body. So if the patient is very weak, if the patient is pregnant, if the patient is a children, if the patient is old, then you basically stick to the lower type of the Virechana Dravyas or Virechan method. These are the methods, Anulomana. Purgation substances firstly acts on the waste material. Of course, the defecation stools, they act on the stool, Purisha. The waste material, that is a stool or the Purisha in Ayurveda, is formed in its proper form because it is a malabsorption is there. So the proper form should be given to that particular dravya. That means the stool matter. After that, the constitution is destructed and is eliminated to the body in semi-solid or liquid form. Whatever that malformed matter, waste product, has been destructed simply breaking away the molecules, and then that particular waste product, Dushita, is taken out in a semi-solid or liquid form. This process is known as Anulomana. Very soft, gentle. In English, in pharmacology, it can be compared with laxative dravyas. Laxative, okay? It is the mildest form of Virechana. The example is Haritaki, performs the function of Anuloma. The market preparation available is Abhaya Rishta. You can easily take, anybody can take 4 teaspoons with equal amount of water before dinner. Remember this word. Because according to Ayurveda, this Virechana action, Basti action, is in the sector of the Apana Vayu. Lower abdomen is the area which is controlled by the Apana Vayu. What you can say, the lumbosacral nerve plexuses are controlling these peristaltic movements and all these activities. Okay, some other examples are like Avipattikara churna. This is market available, 1 or 2 teaspoons with warm water. Then there is a Sukha Saraka churna. Churna is a powder. Castor oil, resinous oil, Erenda Taila. Used, this Anuloman is used always Whenever there is a minor type of the constipation or the patient is complaining of the fullness of the abdomen or the gas in the abdomen, then better way regularly he can consume the anulomana, mildest form of Virechana Dravya. Next, Srausana, the purgative substance, Virechana Dravya, only scratches the waste material sticking to the wall of the intestine and eliminates to the body. The process is known as a Srausana. It is a little stronger than Anuloma because scratching is there. Previously, it was only breaking of the that malformed particles of that stool. Okay, its action is quicker than the Anulomana. Aragvadha or the Cassia fistula, this is a particular medicinal plant, performs the function of Srausana. Famous example, and the market available preparation is Aragvadharishta. Previously, it was Abhayarishta. Abhaya is Haritaki. This is Arakvadharishta. Arakvada is a Bahava or Cassia fistula. Okay. This type of Virechana is used in the patients with Madhyama Koshta. You will ask, sir, what is this Koshta? Koshta is nothing but the sensitivity of your intestinal mucosal lining. How much they are sensitive to the medicines or the food. Okay, so there is a very delicate or very sensitive type of the colons that are called as a mrudu koshta. Some are very tough, dry, and then they don't give the ready impulses or what you can say the reflexes when you give some medicines. That is called as a krura koshta in Ayurveda. In between, it is called as a madhyama koshta. Next, Vedana, more stronger. The purgative substances distract the rigid constitution of fully formed waste material and excrete in the liquid form. You will get the liquid stools always with the Bhedan. It's not semi-solid. It will be liquid. It's like a loose motion. It's like a diarrhea, Bhedana. This process is known as Bhedana. It is stronger than Srausana. Kutki, Picrorhiza Puro, performs the function of Bhedana. One of the famous products with Kutki is an Arogyavardhini tablet. 50% Kutki is present in Arogyavardhini tablet, which is a famous tablet for the jaundice or infective hepatitis. This is the best liver tonic, Arogyavardhini. Okay. Then next, Ichha Bhedi Ras, very common Virechana Dravya that is used in Ayurveda. Most commonly used drugs for Bhedana. It is given in the patients with Krura Koshta. Okay, it is used in the patients of hepatitis, jaundice, especially in the obstructive type of the jaundice. Next, fourth one is the Virechana. The purgative substances destruct the rigid constitution waste material, either fully formed or not, and eliminate in the liquid form. This is the Virechana. So, Bhedan and Rechan, 20-20 type of the difference, but moreover, Bhedan and Rechan are the stronger one. It is the strongest form of Virechana. Trurut, Operculina terpetum, performs the function of Virechana. Also, the Jaipal Kalpas like Ichabedi, Ashwaganchuki, Naracharas, etc. Next, another type of the classification of Virechana Dravyas, a different angle is there. We are talking about now not only strong and stronger, etc., but Snigdha Virechana and Ruksha Virechana. Okay, Snigdha means anchas, and Ruksha is a dry. Okay, purgation induced by oily substances or fatty substances is known as a Snigdha Virechana. It is used in the jaundice, infective hepatitis, anemia, and arthritis. The famous example is Erend Tail or Ricinus communis, ricinus oil. Okay. Then Ruksha Virechana, purgation induced by non-fatty or non-oily substances is known as Ruksha Virechana. Especially, it is used in the obese patient, obesity to reduce the weight. Then Santarpanajanya Vyadhi, typical Ayurvedic terminology, Santarpanajanya Vyadhi. Two terms are there, Apatarpanajanya and Santarpanajanya. Because of the overnutrition, because of the undernutrition. So this is overnutrition, you have to scratch it out. That is the Ruksha Virechana. Okay, overnutrition problems, weeping skin diseases like weeping eczema. Whenever there is a mucoid, serous discharges are there, then you have to dry them out. Trivrut powder, Operculina terpetum, Abhayadi Modak, and Ichha Bhedi Ras. These are the names of the medicines of Virechana Dravyas. Okay, these are the drug formulations available in the market. Ichha Bhedi Ras, 250 milligram with warm water. it is always better to give the Virechan Dravya with warm water to maintain the normal tone of the muscle and to maintain the normal peristalsis of the muscle and to get a normal type of the the activity of the movements of the colon. It's not like a spasmodic. If you don't take the warm water as an anupana, there may be some griping pain or spasmodic pain when you consume the Virechan Dravya. So warm tea or the warm water is the best anupana for the Virechana Dravya. This is controlling the Vata movements, peristaltic movements. Eranda Taila, castor oil, 15 ml for Mrudukoshta, very sensitive, 25 ml for moderate type of the Madhyama Koshta, and 40 ml more. These fatty substances is needed in the Krura Koshta. Krura Koshta is a Vata dominance. Mrudu Koshta is a Pitta dominance. And Madhyama Koshta is a Kapha dominance. Okay. Combination of Trivrit and the Suvarnaparani, Cassia angustifolia, 10 to 30, 10 gram, 3 to 10 gram powder you can mix and taken with the warm water. Aragvada Kalpavati, I'm sorry, Kapilavati. Kapila is very good anti-helminthic. So whenever there is a worms and constipation, better use the Aragvada Kapilavati, 2 tablets before dinner. Then Naracharas, also 250 milligram before dinner. Apana Vayukal is always before dinner. Anupan is always warm water. Don't forget these 2 things. Then Ashwakanchuki Rasa, 120 to 250 milligram, Abhayadi Modak 250 milligram, and Tirut Leha 3 teaspoons. Okay. Virechana in clinical practice, the most indicated disease is ascites. This is a chronic disease, especially when there is a liver problem, infective hepatitis B, serum hepatitis. Then there is a conversion to the, yes, liver cirrhosis, and then portal obstruction, then portal hypertension, and ascites is developed. Ascites, the fluid in the peritoneal cavity, it is accumulated, and this disease always runs a chronic case. It is mainly occurring in the alcoholic patients. So be careful. Alcohol is a very dangerous toxin for the liver. So in ascites, what is happening? The too much fluid is there. Then the modern surgeons or the modern physician, they advise the peritoneal tapping. Peritoneal tapping. The water is taken away. But again, there is a recurrence. But if you admit in the Ayurvedic hospital, the Udara Vyadhi, in Ayurveda, the ascites is called as a Udara Vyadhi. And Udara Vyadhi is basically best controlled by Ayurvedic management. So one of the principle of Ayurvedic management in ascites is Nityam Enam Virechayat. These patients should be given frequent type of the Virechana. Okay, so this is the principle for the Kushta Vyadhi, skin diseases, and also for the Udara Vyadhi, Nityam Enam Virechayat. Modern doctors, they give the diuretics to control this fluid amount, but Ayurveda recommends Virechana Chikitsa. This is very interesting to note. Okay, then another thing I want to tell you about ascites in Udara Vyadhi, Ayurveda Vaidya basically advise the Dugdha Ahara. They say don't drink the water, simple water. Always Udara Vyadhi, ascites patient should take the medicated water, and they should take only and only milk in the lunch, in the dinner for the water. Every time only milk and only milk. Sometimes the taste can be changed by medicated milk. Okay, that we will discuss in some another time about the Udara Vyadhi. But this is the passing comments that I wanted to make about the ascites. Then in Amlapitta, hyperacidity, of course, this is a Pitta Vyadhi. So Virechan Chikitsa, your constipation should not be there when you want to control the acidity. Because modern trend is there, only you do the Digene gel or the Gelusil, antacid, that's it. But no, Ayurveda says your koshta, your stools should be very clear if you want to control even the upward problems. Virechan, as discussed earlier, is used in Amavata cases or rheumatoid arthritis. Ayurveda says rheumatoid arthritis or the gout, these are the type of the cases where there is the involvement of pitta dosha. These are the autoimmune diseases. And personally, my opinion, my experience is that all these autoimmune diseases, they are like a degenerative diseases and having the free radical problem. Free radicals. Okay. So these free radicals are nothing but degenerative problems of the Vata and Pitta predominance. Okay, so to control this Vata Pitta predominance, you can recommend the Virechana Chikitsa for the patients of rheumatoid arthritis as well as the gout. Of course, it is not very frequent, but intermittently you can adopt. Virechana is also beneficial in the Vata problems like sciatica, then in obesity to reduce the weight in the worms. Kampillak is used for this. As I have already told you, Aragvadha Kapila tablet is available in the market. Virechan, we also recommend for the burn wounds. Rose water, dried grapes, Jeshtamadha, Bahava decoction is used for this particular burn patients. Within a week period of the this, because of the Virechana Chikitsa, this healing of the wounds, burn wounds is very easy because the bodies always remain not because you try to understand. You will say, sir, what is the relation of the burn and Virechana? Burn is again predominance of pitta. Heat has been increased in the body. Heat is always there when there is a burn. So that particular excessive heat should be controlled by giving a mild laxative, like for example, rose powders or the dried grapes. These are very soft and gentle and pitta gna type of the medicines. The local application of Shatta Dhauta Grita, very long and complicated name, but very interesting name to remember for the external application for any burn. You must have the what you can say the tubes. This ointment is available in the market in the Ayurvedic shops. Shatadhuta Ghrita, you can apply that. Virechan, especially all the skin diseases. It may be the leukoderma, it may be the eczema, it may be the ringworm infection, it may be the psoriasis, any type. But acne, specifically, this is again pitta problem. There you can treat these with the Virechan. Psoriasis, eczema, most problems for the young, what you can say, the ladies and gents, they give the wonderful results if their stools are very normal. Panchatikta Grita, a medicated ghee, is used as a Purva Karma. You know, every Panchakarma has a Purva Karma, Snehana and Svedana. So for this Snehana, internally, medicated ghee is given, and that specific medicated ghee for the skin diseases is Pancha Tikta Grita. Okay. Now a wonderful case, 30-year-old male complaining of arthritis, RA factor positive. He started after falling in the bathroom. The patient was operated first, laminectomy had done, the deformity in the posture was appeared after the surgery. He used to take the analgesics almost every day to get rid of this problem of the pain. He traveled Kerala twice for specialized Ayurveda treatment but got temporary relief for the short period. Then he was advised for Virechana. For another Vaidya, specific Vaidya in Pune, and Dadimadi Grita was given for the Snehana. After the optimal Snehana, that is 7 days Purva Karma, the 2 days massage with Bala Gudchadi oil was done for 40 minutes in the evening period. Svedana was done after the oil massage, and Ichha Bhedi Ras from Baidyanath company, 1 tablet was given with what? Warm water, of course, in the morning at 8 a.m. He had 12 motions till 4 p.m. He was advised to follow the dietary regimen, Samsajana Krama. After this treatment, patient got relief from pain and had not taken any analgesic tablet in this 3 months period. His weight was also improved. Overall quality of life was improved when we advocate this type of the Virechan Chikitsa to these particular patients. Now, as this is the last slide, you can see we have discussed about pharmacokinetics and pharmacodynamics of Virechana medicine, that is Virechana Karmukatva, types of Virechana, drug formulations, clinical practice, and case study. My dear friends, if anybody of you are interested to get medical advice like anything, want to do Panchakarma or learn Panchakarma, you can WhatsApp me on 9226810630. This is an educational video, so self-medication is never advocated. I request all of you, please like this video, share this video, and don't forget to subscribe my YouTube channel and press the bell button icon to get the intimation of the very interesting videos of all the subjects of Ayurveda. I wish all the best and take care and bye-bye.